I'm very excited to introduce our next speaker, Brent Cunningham. Um, Brent is an accredited exercise physiologist and PhD candidate at the University of the Sunshine Coast. Brent has worked clinically for over a decade and his research focus is on exercise oncology and how exercise variables are monitored, adjusted, and individualized to accommodate psychological, functional, and physiological factors for individuals across the cancer continuum. Brent has been involved in multiple myeloma and exercise trials since 2019 and is passionate about helping develop exercise services and education for people with multiple myeloma. Today, Brent is talking on my movement, individualized exercise intervention. Thank you, Brent.
Thank you, Shani. And thanks to Myeloma Australia for having me. I'm really looking forward to presenting about how you go about individualizing your exercise wherever you are on your journey with multiple myeloma. So before we get started, as Shani mentioned, I'm Brent, and I'm an accredited exercise physiologist and have had the great fortune of working with a lot of people with multiple myeloma since 2019. I was working on quite a big landmark study that we did here in Brisbane, looking at how using various different types of exercise for those with multiple myeloma impacts their quality of life, as well as things like their bone strength, fitness, and bone pain. And so we had some really wonderful outcomes as a result of that study. And that's led us on to a further study that we're currently undertaking. And that's called the MyX Impact Study, which I'll provide a little bit more information at the end about. But I don't want to go through and sort of provide any like overly data heavy content today. So it'll be really more a conversation about things to consider and ways in which you can go about adjusting your exercise, or if you're just getting started or getting back, some of the key considerations that we can go through and think about when we're trying to do that. And for those that may not have ever heard of an accredited exercise physiologist, we're an allied health professional, and our whole shtick, so to speak, is really about using exercise to help navigate different forms of diseases. And that's really the tool that we use. So we're an allied health profession and work alongside nurses, doctors, physiotherapists, occupational therapists, and sort of really well trained in being able to use exercise clinically for your particular goals and condition. So when it comes to exercise, we often know that there are unique challenges, especially around diagnosis or around treatment with multiple myeloma. And I've drawn on most of the challenges that I've seen quite commonly with multiple myeloma. And they're really centered around, like, is exercise safe? And this is both from like your individual level, but traditionally also from the hematologist and nurse level as well. We didn't have a lot of information to inform if it was safe and which particular aspects of exercise weren't or were safe. Also, a lot of people don't necessarily know exactly what they should be doing, where to start and where to go to from there. And then the other challenge that we see with all forms of cancer, but quite commonly in multiple myeloma, is there are just so many days where you experience fluctuations in how you're feeling, the symptoms you might be experiencing, especially around treatment, and what you do on those days. Do you rest or do you exercise? And really uncertainty as to what to do when those challenges arise. So I wanted to focus a little bit more on solutions today and some key considerations when it comes to trying to navigate these issues. So we've been fortunate enough with the MyX study to understand that exercise is really safe in multiple myeloma. And there's also a number of trials worldwide that have demonstrated that it is safe. What we understand is that it's safe if we're using supervision primarily, but independent exercise, so doing it in an unsupervised way, can also be safe, provided that you're adhering to some guidelines around the best way that you can incorporate exercise and keep yourself safe, which I'll talk to a little bit more today. And then we also understand now that really exercise can be adjusted based on how you're feeling day to day. And it's not necessarily going to result in you having any less of a positive outcome. But really, in order to stay safe and to keep you exercising and engage with that process, being able to adjust how much or how little you're doing day to day is going to be a really great way to sort of match those fluctuations that you might be experiencing. And fundamentally, when it comes to exercise, in order for our bodies to adapt and change over time as a result of the exercise, we want to make sure that we're progressively making that exercise more challenging. But we want to do this in a very slow way over time so that we're able to monitor how we're responding. And that also just gives us a longer time horizon in terms of the ways in which we can progress and keep exercising. And there are a number of ways in which we can progress exercise. Sorry, I clicked the wrong button. Alrighty, so where to start? What I'm going to do over the next few slides is talk about some of the key considerations as an exercise physiologist that I have when working with someone with multiple myeloma. And I thought these might be some food for thought for you as well around some of the things to start to consider that might inform some of the aspects around your individual needs when we're trying to prescribe exercise, or some things for you to consider about what might or might not lead to us needing to adjust various aspects of your exercise. This can be things like your lifestyle, your hobbies, activities that are important to you, what you're trying to get back to, maybe what you're trying to keep doing, or if you're starting from scratch. And the photos here are some of the participants from the original MyX study that we did in 2019 to 2021. So these are some of the wonderful people that went through that study and helped us understand that it is quite safe and really effective. So here, there's just a little bit of a flow chart process. And whilst this isn't specific to multiple myeloma, it is quite a good process by which we go through as exercise physiologists or anyone working in an exercise context with people with cancer, and consider the various aspects that are unique to them, such as where they are in their cancer journey. With multiple myeloma, things that we want to consider, like your current treatment and the current treatment regime in terms of, you know, how many times you're having to go and receive treatment, if they're, and the frequency of this. Also, other considerations are if you have any particular lesions, whereabouts these lesions are located. And in addition to that, are those lesions stable or unstable? And are you currently receiving treatment, such as a meta or a bone hardening agent for these? As well as other side effects that you might have experienced. Peripheral neuropathy is something that we consider quite heavily with regards to treatment, such as Velcade. It can sometimes affect the sensory information you're getting from the feet specifically. When it comes to doing exercise, we want to make sure that you're safe and we're able to put you in positions or set you up for success in whatever exercises we're prescribing you. There are a number of other considerations there, but also just if there is anything else going on in your life and with your health. A lot of people have a number of different conditions they might be managing. And as much as you have multiple myeloma, we need to be looking at you as a whole person and the unique needs that you have. So this is all really important information that we consider as exercise physiologists, but also things for you to be considering in terms of how we might be approaching exercise for you. The other really important aspect of exercise is your particular self-belief ability around what you're doing. And also if you have any concerns or there's any apprehension to certain types of exercise. And a big component of this too is your knowledge. So what you know or don't know about exercise, and being able to be informed and have an understanding of what's safe, what you can be doing, the reason you can be doing it is really, really empowering in your ability to engage with exercise. And at the bottom there, it talks about goals and preferences, which really plays a big role in the work that we would do in terms of developing our exercise program for you as exercise physiologists. We want to make sure it aligns with something that is important and meaningful to you, and that the way we're using that exercise is also meaningful to you. So the number one strategy here is starting low and building slow. So when we're starting exercise, we want to consider what the background is that you're coming from. Have you previously been exercising? Are you returning to exercise? Or is it something that you're trying to maintain or completely new to. So we want to explore how we can build upon this in terms of things that you're currently comfortable and competent with, and then also what's within your current capabilities at the moment. So is this something that whilst you're on treatment, you maybe don't have the energy level or say the balance capabilities for at the moment. And so we want to try and meet you where you're at and then build up from there. The other important thing when it comes to prescribing exercise or just considering the types of exercise that you'd incorporate are doing things that are important to you, meaningful to you, and that you enjoy. We know foundationally that you're more likely to do the exercise or the form of exercise that you enjoy. But I'd like to talk a little bit around some ways in which you can maybe sprinkle a little bit of exercise into your life that may not be the exact type of exercise you enjoy, but we know is going to have positive effects for your health and wellness. And this choosing exercise that is important to you really does come back to what are you doing the exercise for? What are your goals? Because this will really help inform the type of exercise you're doing, such as aerobic exercise training, where you're trying to improve your fitness and how well and efficient your heart and lungs work in supplying your muscles with blood. Or are you trying to improve your strength? And so you're doing more of a strengthening based exercise. Or is it where you're trying to perhaps target more of your bone and bone strength? Or is it a combination of all of these? These are really important considerations and things for you to be thinking about as well. And also, if there are exercise modalities there that I've mentioned that you don't quite know about, really great to start to build your understanding of those if it is something that you're interested in exploring. I might have jumped ahead. Sorry about that. Okay, and another common question we'll get is how much exercise should you be doing? And so we have a number of guidelines, both nationally and internationally, around these particular numbers. But I like to refer to these as guidelines rather than guardrails. The reason being is that everyone has unique needs. And as I mentioned, capabilities and capacities, and this changes at different times along your journey with multiple myeloma. So from a broad health perspective, it's generally recommended that you're getting between 150 minutes to 300 minutes per week of moderate intensity activity. So this would be something where it's relatively huffy-puffy. You could have a conversation, although it wouldn't be quite pleasant. And this can be in the form of things such as walking, cycling, and any sorts of sports that you might do, such as going and playing tennis or something along those lines. But it's generally an activity that's associated with that type of intensity. And usually to accrue this, it's best that you're doing something every day. But this isn't necessarily an option for a lot of people. And I'll touch on some other strategies that we can use as well. Another aspect to consider is the intensity that you're doing the exercise at. And so somewhere between 75 to 150 minutes of vigorous activity per week can occur in place of that 300 minutes of moderate, but you can actually use a combination of both of these. And the other aspect that's quite often overlooked is incorporating some type of strength or resistance training throughout the week as well. And as I mentioned, these are guidelines, not guardrails. And so for some people, it's completely unrealistic to be trying to get this much exercise. And these are just particular, time periods or effort levels that you can look to progress towards. But you might not necessarily reach them. And some people might exceed these and other people might do a lot less, but it's all about making sure that that's fitting and working for you. And along the way, making sure that it's safe and enjoyable with regards to the exercise we're selecting. And as I mentioned there, it talked about moderate effort, vigorous exercise, and vigorous intensity. And a lot of people might not necessarily have a frame of reference for how effortful that should feel or how hard they should be exercising. And it can be quite challenging to give a sort of general blanket rule as to the effort that you should be exercising at. But what I've popped here on the slide are two particular scales that we commonly use in exercise prescription. that really are subjective. So it's based on how you're feeling in your perception of the effort. And the reason we like to use these is that day to day, depending on how you're feeling, and that can be influenced by a whole host of reasons, your subjective effort, provided that you're considering the descriptions there of moderate to somewhat hard, you might end up doing a little bit more or a little bit less, or you might end up doing it a little bit harder or faster or a little bit slower. And that's absolutely okay, because each and every day you're trying to work at what feels like a moderate to somewhat hard effort for you. And by no means does it have to be somewhat hard or moderate. It can be light to moderate. And there are other times where maybe it's a little bit more on a somewhat hard to a high intensity. But as a general rule, if we're considering the moderate intensity effort, somewhere in that moderate to somewhat hard effort range, or a 5 to 6 out of 10 on a 1 to 10 scale, can be a generally great place to be centering your exercise intensity around. And that's predominantly more associated with any sort of aerobic exercise you're doing, anything that's getting you a little bit more huffy puffy. When it comes to strength training, what we try and do is make sure that you're exercising or doing enough reps of an exercise to get close enough to you not being able to do any more reps of that exercise. When we're getting used to exercise, it'd be really hard to sort of know what might be the failure point, at the point at which you can't do any more repetitions. But as a general rule, we're wanting to try and have you exercising and stopping somewhere around where you feel like you can only do 2 or 3 more repetitions. It's absolutely okay to do less. And we actually have some evidence to show that even being a few more repetitions, such as 5 away from not being able to do any more, does have very, very similar results to stopping 2 or 3 reps away from failure, or even going to failure. So we've got a lot of options up our sleeve, but I just wanted to give you something tangible today as a little bit of a benchmark for how effortful you should be exercising. And this comes back to you as well. It's really important that we consider how you're recovering from exercise session to exercise session, and then be adjusting this intensity accordingly. If you find that you're having a hard time recovering, or in some cases you can feel really wiped out as a result of exercise, that could indicate that maybe we're exercising too intensely, or more often than not, maybe we're doing a little bit too much too soon, because it does take time for our body to build up and us to adapt and build our capacity over time. And this is an area of research that I'm currently exploring. And so whilst we don't have a lot of exact evidence on how we do this, we are predominantly operating off some theories around navigating the ups and downs associated with multiple myeloma and the treatment. And this is something that I'm diving into a lot more with the current MyImpact study. So this idea is that as we go through treatment and just generally being a human, we're going to have these various different periods of up and down. And as this can be as a result of poor sleep, pain, stress levels, just general energy fatigue, a whole host of reasons. For some days might feel a little bit lower in terms of your readiness to exercise. And other days you might feel quite ready to exercise and that you're in a good mood and things are feeling great. We also know this can be heavily influenced by your treatment as well. And so this little visual representation here is showing you, it uses infusion, and this is just a generalized figure that we have, and it's not specific to multiple myeloma. However, what it's showing here is the different lines associated with the different colors, and how these can change day to day. And what we're trying to do over the long term is match your exercising effort to the days on which you feel your readiness is high, and then also try and bring the exercise effort down on the days that you're feeling that your readiness is lower. And here you can see commonly after people have gone through treatment and they've maybe started to bounce back a little bit if treatment had an effect on them, their readiness is a little bit higher, but generally what's happening is they're not necessarily adapting. And so by the time their readiness is high, they've not necessarily adapted to that. And so what we're trying to do is with your exercise, and this is something that you can do on your own, is on days that you're feeling great and things are feeling well, you can generally do a little bit more exercise or with a little bit more effort than on the days that you're not feeling well. So we want to try and still incorporate some type of exercise if you're a little bit lower on that readiness level. Because over the long term, if we think about these squiggly lines, whilst we see these big waves over the long term, that's generally going to be trending in an upward direction. So you're still getting somewhat of an important exercise dose, regardless of how you're feeling day to day. You want to try and work with those waves rather than feel like you've got to do a certain amount, even though you're not feeling up to it. And a common question we get, and this was also quite a common consideration by hematologists when Jenny did the original MYEX study, and we're interviewing a number of people about the concerns they had and particular areas of interest, is lesions. And so what do we do when we have lesions? So we know that provided your lesions are stable based on your imaging and your specialist advice, and that perhaps you're undergoing bone hardening medication, that we can exercise areas that do have lesions. But we have quite a few rules around this as exercise physiologists, and that is not exacerbating any current bone pain, progressing very slowly, and not necessarily adding any particular load at the start. And over time, as you're responding well, we might make that exercise a little bit more challenging. And that's for things such as strength training. When we're targeting more of a bone-specific exercise and we're doing some exercises called impact loading, we would generally recommend that you do this in a supervised environment, at least initially, whilst you're getting some education and having someone monitoring how you're responding in order to progress you safely. And so that would be something which you would talk to an exercise physiologist about, or a physiotherapist. But generally, provided that your lesions are stable and you're progressing your exercise slowly and you're not exacerbating pain, or if you are experiencing some pain, you're talking to your hematologist and you're regressing that exercise, it is really safe to be able to exercise. This is something that you would need clearance for and guidance from your treating hematologist about this before you commence, and something that would be worthwhile just checking with your hematologist about along the way. We want to generally avoid any exercises that would put you in a position where you might have a fall. And so usually we would do things where you're in a stable or well-balanced environment, and choose exercises for you, and also for yourself, thinking about exercises where you feel sturdy and safe in the way or position that you're doing them. And then also exercises that you can do with control. So anything that is moving rapidly or it's not able to be controlled, the speed, that's when we can potentially be at a little bit of a higher risk of having something untoward happen. So just something to consider there when you're selecting the exercises. A really simple example could be opting to do something seated rather than standing if you're just not quite feeling sturdy enough in the standing position, or maybe holding on to something while you're doing the exercise to just give you a little bit of external support. And as I mentioned earlier, we have those 150 to 300 minutes per week recommended, but that is, and it recommended you're trying to do 30 to 60 minutes per day. And that can be an overwhelming amount of exercise to consider doing. And sometimes, with life, we don't necessarily have that huge amount of time. What we've started to understand a little bit more now is that we can actually break our exercise up throughout the day, and it not necessarily be any less effective than if we did it all at once. And so here, this is an image with a concept that's we're slowly understanding more around, called exercise snacks. So this is throughout the day where we might do very, very short duration. You could even be considering 1 to 2 minutes of exercise. And that exercise might be done at more of a somewhat hard to hard intensity, or even a little bit more vigorous, but it can be incorporated in something that you're already doing. And that could be if you're walking upstairs and you have the capacity, just trying to walk up those stairs with a little bit more vigor or a little bit more intensity. Or some examples are, some people will just march on the spot. Other people might do if they're doing some type of activity of daily living, such as vacuuming, really crude example there, but they're trying to do that with a little bit more effort for 1 to 2 minutes. We've seen in some large data sets that it actually has quite a significant impact on some of the risk factors associated with cancer. And this is also testament to maybe you're not doing the exercise snacks, but you might, rather than do 30 minutes all at once, you might do 15 minutes in the morning or 15 minutes later in the day, or maybe even breaking that up even more. Or across the week, you're just slowly trying to accumulate some more exercise in times that you have available. These are all strategies that you can use that mean that you're able to get that dose, but it doesn't necessarily have to be all in one big lump sum. And I'm actually coming to my final slide. This is where we're talking about some approaches that you can investigate if you're wanting to try and get a little bit more advice or guidance around how to exercise while you've got multiple myeloma. And I think in the first instance is talking to your hematologist if they currently know or trust any particular exercise professionals, and this could be a physiotherapist as well, that provide services to people with multiple myeloma, or if there are any particular programs, community-based or hospital-based, that they have access to referring you into. And over time, we'd really like to be able to sort of have a little bit more of a registry or database with Myeloma Australia established for you to find this information. And the other approach is to go on to the Exercise and Sports Science Australia website, which I've provided the link there for. And there's a find an exercise physiologist function. So you can search for exercise physiologists in your area. However, just with what I would recommend doing is, because there's not necessarily an explicit filter to say that they have experience with multiple myeloma. So I've put a few questions there to consider that you'd want to talk to them about prior to maybe engaging in exercise services with them. And it's if they have experience and understanding of multiple myeloma, where we're still developing a lot of the evidence around sort of the best ways we can go about working with people with multiple myeloma. So it's really important that they feel confident in their ability to work with you and understand you and your particular individual needs, treatment needs, and the safest ways to be exercising. And also, in addition to that, are they aware of lesions and what they mean for exercise? And are they able to also give you the knowledge and education to be able to take away and exercise safely on your own without needing to rely on that exercise professional indefinitely? And so there are some great strategies through the enhanced primary care plan through your GP, where you may be able to get subsidized visits across a calendar year to see an exercise physiologist as well. So that can also be a way in which you're able to have a touch point less frequently throughout the year, but you've still got some expert input in help guiding you. And as I mentioned, we're currently underway with another myeloma study, exercise study in inner Sydney, so at the Chris O'Brien Lifehouse, and then also in Brisbane, where we're doing a 9-month exercise intervention, primarily looking at a little bit more bone-specific targeted exercise. And so I've put the website there in the QR code, a little bit of a shameless plug about this study, but we're currently still recruiting. And yeah, very much interested in anyone in those areas that would like to be involved, expressing interest, and we will give you a call and have a chat to you about the process. We're sorry that it's not available in a wider range of areas. And I know Sydney is a very big place. So if you're in Sydney, yeah, it is around the Chris O'Brien Lifehouse. So yeah, more than happy to field any questions that anyone has about that. But more information about the process and overview of the project is on the website there or via that QR code. And I want to thank Myeloma Australia for giving me the opportunity to come on today and talk to you about some of the considerations when it comes to individualizing exercise. It is a huge topic to unpack. So I'm more than happy to answer any questions that anyone has, or take any follow-up emails down the track. So there's my email address, and also the MyX Impact website, where you can get in contact with the research team as well. Thanks very much, everyone, for listening.
We've come to a point in the program where we thought it would be nice to hear from one of our members. And so it is my privilege to welcome you to Laurie, or introduce you to Laurie. So I had the pleasure of connecting with Laurie via our online statewide support group a couple of years ago. He's one of our New South Wales members. He joins our statewide group on the regular and always did. And then he was actually instrumental in getting a local support group set up in his area in Shoalhaven as well. We just wanted to have Laurie come on today just to talk to us briefly about when he was diagnosed and sort of where he is at in his treatment journey now. And then we've got a couple of questions just to talk through because he's quite the proponent of exercise physiology and how that supported him in his treatment. But hi, Laurie.
Hi, Kath. Yep.
If you're happy, can you just give us a little brief intro as to about your myeloma and when you were diagnosed and where you're at now?
Sure. I just feel that I'm a bit of a late starter. I didn't start finding out that I had myeloma until I was 82 years of age. It was my local GP that found it in a blood test, and I've been having treatment since November 2021. I'm now in my 5th cycle of treatment, and I've been along the bortezomib and the daratumumab, and I'm now on the carfilzomib. But I am having a little bit of trouble with side effects such as extreme tiredness or fatigue. But I've kept that up, and in the middle of my treatment, we started a gym at the cancer clinic, and I joined that. So I've been at the gym for about 12 or 13 or 14 months now, and it has made a big difference. Both the exercise part and the ambience of the group that's there. I think the amount of times we laugh and giggle and do things, it's a wonderful therapy. After we finish the an hour or two at the gym, I usually go for about an hour. We sit down and have a coffee together and compare all our ills and quaints and so on. And it's a real good, make me happy day. I think it's been a bit of a long trip, and for me, a bit bewildering because I didn't know anything about it at all. But thanks to Kath and lots of other people have helped us a lot and put us on the track. I didn't have any, what do you call that other one where you have your parts renewed?
The transplant?
I didn't do that. I was told I was too old for that. But I am going along the rest of the way and very happy with the haematologist and particularly the Cancer Care Centre at Nowra. It's a pleasure to go to and a super happy place to be at.
Excellent, Laurie. I had the privilege of coming and watching Laurie and his team at the gym, and they worked really hard. It was impressive to watch. I guess it follows from what Brent was talking about, because it's led by exercise physiologists, and they very much monitor you individually, don't they? And they work on different programs for all the people that come through. Full assessments, yeah.
Yeah, they do. And I was going up on the scale. We have a weekly sheet of everything we have to do, the types, how many times to do it, and so on. And then about 3 weeks ago, I got quite sick with a rhinovirus, which knocked me around a bit, and I lost about 6 kilos in a week. So I went back, and the physiotherapist said, "Oh no, you're going to start from the beginning again." So I didn't mind, and I got there and started to do my exercise and felt a bit stronger than normal. So I put in 20 instead of 10. Well, I got reprimanded for that. But I thought maybe that's good for me to keep an eye on it and don't get carried away. So it is a very controlled thing, and I enjoyed Brent's talk, seeing how controlled his system is. Ours is very similar, and it's another good feeling that I've had. The other thing was the protein lady. What do they call it?
The dietitian?
Yeah, the dietitian. She's been a big help too, just recently, and trying to get my weight back up again. And I'm looking forward to getting back to what I was. And continuing on with a bit of a
Excellent.
stronger thing. Yeah.
Excellent. It's worth me mentioning as well that Laurie, we've got our My Greatest Walks coming up on Sunday the 30th, and they're our big awareness a walk for myeloma, Myeloma Australia. You can check the website to register. There's around 30 walks around the country. If there's not one local to you, you can sign up and walk where you want. Laurie is the leader of a group local to where he is. So we're glad that you're on the road to recovery, Laurie, after that virus, and you'll be right to walk on the Sunday.
Oh, well, the inspiration there is fish and chip picnic at lunchtime. So we're walking by the seaside at Greenwell Point, and last year we had about 35 members come along, and we wore our Myeloma Australia t-shirts, and it was a very nice day. So we're looking forward, we hope, to good weather and a bit of a picnic at lunchtime.
Excellent.
So hopefully it works well this year.
Thank you, Laurie. Thanks so much for being here and just for sharing a little bit of your story with us. It's just important to hear that patient voice, I guess, in the midst of all of us talking. We heard that earlier, that although we might be the experts in one side of things, you are definitely the expert in you. So thank you for sharing your time with us today and your story. Thanks, Laurie.
You're welcome.